through today, we'll try and get through them tomorrow. Yeah.
All right. Well, we've got the first question here. This is to Dr. Feldman. Do you think doctors' education could be improved re Morgellons? Let physicians know some research that was presented today. Absolutely. Sure.
My question here are, what are the thick hairs that aren't my hairs? Well, we'd probably have to do, I'd have to see that particular specimen, and then to determine what the composition is, I would have to do some kind of specific staining. When I look at specimens, I often use a Gomori trichrome, and then I can determine if it's collagen or keratin. There's spectroscopy and other methodologies we can use, but I can't, with specimens, when I receive hundreds of them, analyze every single specimen, and then if I don't have the specimen in my hand, I can't tell you. It's possible sometimes patients will bring me a sample and I've analyzed it, and it will be a textile fiber. And that the problem is that embedded fibers in the skin, I can study and I know where they have come from. There's a provenance to them. But when I get a fuzzball or something that's not attached to the skin, I, as a scientist, can't determine where that thing originated from. So I'll be talking a lot more about that tomorrow in this sort of topic, but I would like to say something in defense of Dr. Feldman. That is, we're talking about a condition that's very polemic and controversial, and so it's very poorly understood. So there's many doctors who are probably excellent doctors if you have a melanoma, but they fall short when you have a very poorly understood medical condition that we're just learning about. So we've got a long ways to go, and we have a lot of research to do.
I just want to also say things are changing. They might not have for you as an individual, but 6 years ago, every email and phone call I got that was from a healthcare provider was basically hate mail. You got to stop doing this. I'm going to turn you into your president. I mean, I can't even remember. It's been 2 years since I've gotten anything like that. What I get now, almost every week, is a physician saying, I've got this patient, I hear you work on this weird disease, tell me about it, or what can I do to her, or who can I refer them to for information. I know it's not fast enough change, but things are changing, and so I think there's reason for some optimism about that. So this question is about if a person can't afford the cost for testing for Lyme disease, or a doctor who treats it, any kind of funding or do any insurance companies cover it? And I'm not really qualified to answer this question. However, if you're anywhere near a larger urban area, there are typically low-cost and occasionally free clinics. In Tulsa, OSU has partnered with Neighbors Along the Line to do a Tuesday morning clinic where we run all 113 of the medical students through 4 at a time to help the doctors. They play pharmacy tech, they do the vitals, they put it into the electronic medical record, and it's a completely free clinic. Now, you can come in there and say, I've got Morgellons, what can you do for me? But always keep in mind that on top of Morgellons or chronic Lyme disease, there's a lot of other things that can go wrong too. And so that's why it's really important to have some sort of a medical home that you can be seen, even if it's not for Morgellons, but just, I mean, I don't have Morgellons, I still get sick and have to see the doctor periodically. If your immune system's weakened from fighting something, you're even more at risk for that. So I would say, you know, look for resources like that. Is there a place for people with Morgellons to volunteer for research? Not that I'm aware of. You could talk to some of the other speakers here who might be able, or Cindy can perhaps help you out with that. In the med school setting or a university setting, doesn't even matter about med school. I mean, it'd have to go through a human subjects institutional review board, and so at the moment, for me, that's not an option. I don't know about other places.
We have ethics approval on our research studies, but if anybody's interested in volunteering, they can ask Cindy about it. But understand that when we do research, it has to fall within a particular project that we're doing. And when I'm involved, I rely on collaboration with universities. So you have to be very patient. I can't always give people any results to research. Research data cannot be used diagnostically, so don't volunteer as a research subject and expect to get a diagnostic test result. But you know, we're not going to learn about Morgellons or any diseases if we don't have research volunteers, so we really appreciate it, and please speak to Cindy if you're interested in volunteering for research. I also have a question about that a lot of glitter and metallic things are found in the specimens, and what is this? I'll be talking a lot about that same topic tomorrow, so I'm going to pass this to Dr. Feldman.
Is there any treatment for severe facial scars? And there are a variety of treatments for facial scarring. I don't do that kind of work. I'm more of a medical dermatologist, but you could have a series of peels for mild scars. Surgeons could cut out holes and sew them up. Grinding of the face could be done to smooth out horribly, but whatever, I wouldn't recommend having any of those things done until the disease was cured, because you don't want to have all that done.
While we're looking at it, we see we've got a lot of questions about treatment, and actually tomorrow is when there's going to be more the presentations will be on treatment. Today it was just mostly all science and research and that type of thing. So tomorrow will be about more about treatment. There's also some testing, questions about testing, and that's also going to be covered tomorrow. You can look at your schedule and your booklets and see the presentations that will be tomorrow. Here's a question for the foundation, it looks like. Is anyone creating a core website that lists resource information that not only has all the papers and studies, but also Morgellons friendly and Lyme doctors who take and don't take insurance, as well as where they're located? Well, if you look on our website, we've got patient resources as one of the links at the top. There's drop-down menus there, and you know, Lyme doctors don't always advertise that they're Lyme doctors for obvious reasons. So it's going to be kind of hard to find a list. There are some places that maybe we can add more resources, but for the most part, you're going to need to go to find doctors. You're going to need to just go to the ILADS, International Lyme and Associated Disease Society. Go to their physician referral, put in your zip code, and they will send you the options nearest you. There are a few other sites, and I'm hoping we can add some more to the website for that. And also ask for a list of resources that list and explain the most helpful and effective supplements and medications. Our foundation does not promote any particular type of treatment. That's not the type of foundation we are. So we are, we're set up just, for research and education. So, we're not doctors. We don't prescribe. There are lots of places on the internet where you can go and look at all different protocols, of all different doctors, both herbal protocols and antibiotic protocols. So there's plenty of places on the internet to look for that type of stuff. How much more time do we have? You got one?
Well, what Dr. Shapi in her negative controls did do, they weren't biopsies. So in our studies that we did, the skin mostly came from calluses that were picked off superficially from patients. And we found that those were full of Borrelia and other organisms. But we also looked at skin that had been picked off of Lyme patients who did not have Morgellons, and skin from Morgellons patients that was not in an area with lesions. And we didn't find, in Eva's negative controls, we did not find any microorganisms. But I think the difference was that in your study, in Dr. Wymore's studies, they were biopsy sections. So I think that made a difference.
That was the official awkward pause.
So many of these are about treatment that they just don't fit in so much with today's here's one that maybe Dr. Weimar.
This question is, what if Borrelia is getting lost in translation? None of us are too sure what that means, but can Morgellons break the blood-brain barrier? You've got to remember that Morgellons is not a microorganism. So when we talk
Hello, hello.
Have I ever diagnosed someone with Morgellons? Well, there's no code for Morgellons. I have diagnosed people with delusions of parasitosis.
I think that Mike's going to stand right here.
And so when I have diagnosed people with delusions of parasitosis, have you ever prescribed anything other than... Oh, so have I ever diagnosed someone with Morgellons? The answer is no. I've only diagnosed people with delusions of parasitosis. And so the next part is, if so, have you ever prescribed anything other than antipsychotic medications? So since I've never diagnosed someone with Morgellons, I've never prescribed a Morgellons patient antipsychotic medicines. However, those patients who I've diagnosed with delusions, yes, I have prescribed for them antipsychotic medications. And when they've worked well, and the patient and I were both when the patient was very happy with the outcomes, that made me feel really good. And maybe that's not what you wanted to hear. So but again, I've not diagnosed Morgellons, but have I given people with delusions of parasitosis other medicines? Yes, I have. And part of my establishing a relationship with them, if they say, I've got these worms, I need to have, what's the worm drug? Ivermectin, thank you. Yeah, I was pretty confident you could help me with that. So, ivermectin, yes, I have given people a dose or so of ivermectin. Sometimes they've wanted more than I've been willing to give, but I've given that. I give people doxycycline for acne, like left and right. So if somebody said to me, I really want some doxycycline, I'd be like, sure, you have all the doxycycline you want. I'd make that drug over the counter. Any other specifics that you... No? Okay.
Okay, well, is there any connection between AIDS and Morgellons? Well, the causative agent in AIDS is HIV. I do know of one person who claimed to have Morgellons who was HIV positive, but there's no connection that... and then what about, you're told by a doctor not to go into hot tubs or saunas if you have Morgellons or Lyme disease. Is this true or not? Well, first of all, just in general, if something massively inflammatory is going on, hot tubs are not necessarily the best thing. Some autoimmune disorders, there will be a flare-up after going into a hot tub. Many doctors that treat MS recommend against really hot tubs for any extended period of time. You get T-chalk proteins going, it can trigger an inflammatory reaction. So, but other than that, I've not heard of anything. I guess we're done now. With what? It's a heat. Well, it's heat. So I don't know how hot that gets it, but it's the hot tubs. You have a big thermal mass, so you're really taking in the heat from it.
Thank you all.